in nature and not a substitute for medical advice. We really encourage your kind of questions and comments. We really would prefer this to be much more of a kind of a conversation. I think it's kind of more fun that way. So if you have a question, feel free to kind of type it in the chat, or if you're feeling kind of comfortable just appearing on the video, then feel free to unmute yourself and ask your question. But it would really we'd really be delighted to kind of have your any of the kind of questions you have. So this is part of 3 discussions we're having at NAP on the transition to parenthood. The first starting with moms, and then later in April we're going to talk about fathers, and then in May we're going to talk about adoption and the complications in that whole experience. So being a parent is a rather monumental event in many ways, and our culture gives very little recognition or appreciation of this transition. As shown by the poor parental leave policies in our country. So today we'd like to turn our attention to this important transition with the help of 3 panelists. Mariana Pereira is an associate professor at UMass and one of the leading authorities on the changes in the brain that occur during pregnancy and postpartum. When a well-regarded journalist, Chelsea Conaboy, wrote her book entitled Mother Brain, Mariana was one of the kind of experts that she turned to inform her work about how neuroscience is really changing the story of parenthood. Kate Bohne is our lactation consultant here at NAP, and well, she's just awesome, as those of you know that. And Johanna Neumann is a therapist who is located in San Diego and has a practice in Northampton, and specializes in the challenges that occur during the perinatal postpartum kind of period. And she's our kind of expert on these topics. So I wonder if we could kind of begin, Mariana, and you could give us an idea of the fascinating changes that occur in your brain as a result of being kind of pregnant and what happens postpartum. And does this mean, because as the papers report, you've lost gray matter, that your brain has turned to mush and it's not good?
Yeah, I'd be happy to. Thank you. I first want to, again, thank you for organizing this workshop. I think it's really important to talk about how the parental brain changes as a result of pregnancy and interacting with your new baby. And I think it's something that, just educating about what those changes are and how those changes are there to support this, new super important task that new parents have, which is kind of, help, that bonding and that interaction with that baby. One thing that, and I want to also emphasize that a lot of the things that happen in the parental brain are facilitated by hormones of pregnancy, but without hormones of pregnancy, also those changes happen in non-gestational and in fathers, right? And so there's a lot of changes in the brain that support this transition into parenthood in non-mothers or in individuals that haven't experienced gestation, that are very remarkably similar to those experienced by gestational individuals. And so perhaps the more obvious way to talk about it is what happened during gestation and that transition into new motherhood. And so these like important fluctuations in hormones associated with pregnancy are there to coordinate physiology with neural changes, right? With changes in your brain. And so the same hormones that facilitate like the breast development and production of milk later on, or that maintain, contractions in the uterus at a minimum, are the same hormones that are going to start acting in your brain and changing aspects of your brain to then facilitate, upon first exposure to your baby, a full responsiveness to those new cues and signals that your baby are providing. And so changes, in kind of general ways, changes can be changes in volume and changes in structure, right? And so a little bit of what Edward is talking about is changes or reductions if gray matter, right? Which is where, it's mostly it's associated with the number of neurons or the number of glia cells, the interaction between those neurons, so how many synapses, how much communication points are there, things like that. And so there's been, which I'm very excited about, like recent studies showing that changes in the human brain throughout pregnancy and postpartum. And so there's a lot of non-human animal work that has support this, but now with the advances of imaging technology, we can actually, monitor changes throughout pregnancy and postpartum in mothers, as well as in fathers as they transition from before and after. And we can see that there's significant changes in volume, particularly in cortical areas that are thought to be very significant for social cognitions, for this ability to empathize with others and this ability to understand other signals, etc. And so even though, which I think is the beauty of this is that less sometimes is more, right? And so changes in gray matter are just fine-tuning circuits so that information can be, more, can be faster, transmitted faster, but also without noise, so that things are prioritized in a way, right? And so some of those changes happen during pregnancy, so that upon first exposure, mothers are able to perceive with increased acuity signals from their babies. They are able to process that information faster, and they are able to prioritize that information over all other things that are happening in their lives. And so they have sustained attention, they have increased ability to understand needs, they have an increased energy and motivation to interact with their babies, things like that. And then, there are also changes that happen or continues to happen as they interact and that relationship develops, right? And so all these changes that hormones are facilitating are mostly thought to synchronize the ability to be responsive with the first exposure to your baby. And then from there on is this kind of ongoing relationship that reinforces those changes and pushes those changes forward, right? And so in a way, it can be seen as a developmental stage, pretty similar to what we see or understand from adolescence, right? Where there are like these very dramatic changes that allows for significant changes in behavior. And it's a process that where the learning comes from the experience of interacting, right? And so in a way, a parent becomes a parent through interacting with their baby. And that's how, when I was referring today that hormones facilitate this process, but that similar changes occur in non-gestational parents, is because we can kind of recruit this same circuit just by close interaction with our baby, right? So we learn about our babies, and we learn how to interact with their babies through that interaction that induces changes in the brain, that are long lasting.
So, so these changes, one for are hormonally induced for the birthing parent, but can be acquired by experience by, say, people like me. What
Yeah,
are
exactly. Although I will add that in fathers that are, or partners that are heavily involved in the pregnancy experience, right? Those partners that go with their partners to the OBGYN visits, and they kind of are present for ultrasounds and stuff like that. They experience hormonal changes similar to that of the gestational parent, right? And so there is in some cases, although you don't have to, right? And in the cases where you're not exposed to hormones, maybe you need more time, right? And it's that interaction that kind of like eventually produces those neural changes in partners that are like that are participating in during pregnancy and early postpartum. Those changes happen at a similar rate as the one with their partners.
So let me just ask a question and sort of put it in very annoyingly simplistic terms. Are these brain changes that are occurring supposed to make you fall in love with your baby? Or are they serving some other function?
Well, I think so. All those changes are there so that significant processes that are important for parenting become available, right? And so parenting requires thinking, right? It requires attention. It requires multitasking. It requires cognitive flexibility, right? It requires a lot of things, and so. All the changes that happen in the brain are there to facilitate that interaction, right? Now, this is not a universally shared experience, right? We are all different, right? And so and that agency, if you want, in parenting, right? How not all parents parent the same way, right? Is related to your genetics, is related to your early life experiences, how you were raised, and what happens throughout your life, is related to your social context, how much support you have, is related to your culture, right? What's that informs how you're going to parent, how you're going to understand things, how you're going to, and it's related to your present affective state, right? And so that's why it's such a different experience, and not everybody mothers the same way. And I think it's significant how in this country there's no a maternally, like, it's not, not everybody gets a maternity leave, and then you have to go back to work right away, and then childcare is so expensive too, and so all those things add stressors to an already stressful life event, right? And so it really it's significantly important whether you have social support, right? And whether you are in the position where you can actually take some maternity leave and spend time with your offspring. Because I will say that the one thing that I would stress the most is that for a healthy transition and for a healthy interaction, parents need to be able to be with their child. And so not having that opportunity, because maybe they have to do 3 jobs, right? And they have to be running all the time, that really significantly impacts your ability to parent.
Mariana, I'd be kind of curious from your position as kind of an expert on this topic, what has kind of surprised you or struck you the most in terms of this kind of, emerging area of kind of information that's kind of really, surprised you or kind of delighted you as we find out about this, these changes in the kind of in the parental brain?
So from my perspective and why I really got into study this, I was very impressed by how, something that is, significant of parents is that they not always parent the same way, right? That they are really attuned to what their children need. And so as a behavioral neuroscientist, I found fascinating that we can express a behavior so plastic and so flexible, and in order for us to do that, the brain has to have significant plasticity in terms of cognitive and motivational and affective processes and coordination between those processes to do that. And so that was what kind of inspired me to study this behavior, but it's also the part that surprises me the more is how it's not seen like that, right? How it's not seen as parenthood requires thinking, right? Or that it's just all about maternal instinct when really there's nothing about that, right? And it's not that we just at some point we just like switch and become parents. It's like it's a developmental process that many factors go into that, or that when we have discoveries such as the one that I was just talking about, how there's reductions in gray matter that is seen as, oh, that's baby brain, and that's why there's like lack of like cognitive decline, right? And it's like it's exactly the opposite. It's exactly the opposite. It's such an impressive transformation that really we go from selfish individuals to completely selfless individuals, where the focus of attention now and the resources are directed toward the well-being of our babies, and that requires, I mean, these are babies that are not, they don't necessarily are not the best are communicating what they need, right? They really rely on the parents' ability to understand and advocate for them, right? And so the ability of parents to understand that their babies have a mind of their own, and that they can nonetheless understand what they need and provide behavior that really resolves those needs is fascinating, right? It requires really very sophisticated executive functions, right? And so thinking that or reducing parents or mothers in this case as just having baby brains is is crazy to me.
How do these changes compare to the changes that occur in the adolescent brain, which is also viewed as a kind of a time of dramatic transit? Similar, the same, more?
Yeah, no, they are remarkably similar. This fMRI, there's a group that has done a lot of really cool studies, kind of following mothers and fathers in this transition into parenthood, and they had this idea of kind of comparing that the magnitude of change in parents to that of adolescent girls, and actually found that is remarkably similar. The reductions in gray matter, and how likely that reduction in gray matter is associated to synaptic pruning, which is kind of like we're kind of like reducing the number of communication points so that we can maximize information between critical targets. And that's seen as a way of increasing or fine-tuning, if you want, circuits. And the fact that these changes don't happen everywhere in the brain, but rather in very specific regions of the brain, and regions that are related to social cognition and are related to motivation, and are related to processes that are key to parenting, is significant. Yeah, so I think the just to add to that, I think the fact that the changes that are seen in with new parenting or parenthood are very similar to that of adolescence, I think that has been very helpful. Just how to frame it, because now, instead of, otherwise it could be seen as degeneration, right? Decline, which is how it has often been seen. And now you can see that is probably an adaptive process, right? It makes more sense to it's a good way to kind of change the way we, or how we see it, because obviously they are young, and they're like, developmentally kind of reaching a milestone, and so I think it's been very useful. Yeah.
Thank you. So, Mary, I think that we may want to circle back to some of your expertise, but maybe we could shift. And Kate, maybe could you tell us a little bit about in terms of the transition to parenthood, the whole experience of breastfeeding? It seems like, on one hand, something that should be quite natural, but on the other hand, quite pressure filled, and it's all happening in the first week of life, where people are dealing with that tsunami of kind of hormonal kind of stuff that goes on during the first week of life. I wonder if you could share some of your kind of thoughts about what you see and what you notice in helping young moms.
Sure. Yeah. Well, I want to start by saying, Mariana, that was really interesting and affirming for me to learn about that, because I see that so often in people, sort of maybe on a continuum a little bit, like some that feel more ready to accept those changes, I guess, and others that maybe struggle a little bit with that and second guess themselves and seems like maybe fight against it a little bit, but it's really interesting and so relevant to what I do. So I've had a lot of clinical experience. I work now all at NAP in the office and running our breastfeeding support group, but I also worked in a hospital setting, so dealing with people in the immediate postpartum period, which is for a lot of people a whirlwind for them to kind of get their bearings and understand what this means to take care of their new little baby. And I find, yeah, for some people, that postpartum period is really calm and peaceful, and they enjoy it, and there's so much wonder about like this new little person that they bring into the world, and then learning about them in like a very like gentle, calm space. But because of the work I do, I often am talking to people who are maybe not having the most easy experience with it. So there's a lot of things that I encounter, sort of throughout that period that I feel are fairly common. So those are the things I wanted to mention today. And one of them actually is, Ted, what you had brought up in the beginning, is that we in our culture, we tend to not sort of revere this period or give it the sort of attention it deserves. It's a lot of focus on the prenatal health care and checking in at the various points to make sure that people know what to expect at each stage, make sure the baby is healthy and all of that, and the mom is healthy. And then we also, in our culture, I feel we focus a little bit more on the sort of material aspects and like the products you might need for your baby. But there's not a lot of information about what Mariana was just talking about with the growth that parents will eventually do as they're learning their baby and learning how to become parents themselves. So that's something that I feel I see a lot about, and unless parents have had a lot of experience in a big family with tons of kids, or like lived in a neighborhood where they got to play with all kinds of different kids and little kids too, they may not feel very well prepared for that period. And sometimes taking care of a baby, especially a high needs baby, is kind of relentless. And so they may struggle with like what that actually means to take care of a baby in the day-to-day and minute to minute of that. I think one of the things that we were just talking about that I found really like interesting, and again, very relevant to what I do, is that a lot of people feel like they should know exactly what their baby needs. But if they run into struggles there, like if their baby isn't gaining weight well, isn't feeding well, they feel like they messed up somehow, like it was their fault that this all happened. And sometimes, so being in a medical setting can be overwhelming to parents or a little bit scary to parents. Sometimes the recommended interventions can be scary to parents, but I find I kind of approach it from, this is all learning, and you're learning your baby, but you're also learning like what you might have to do to feed this little one to be able to get them through this, very discrete period. That doesn't take long to fix that issue of them gaining weight, but it sometimes can be very upsetting to parents in that time as they're trying to figure out how to do that. Another thing that I think that I see quite a bit, because I'm obviously seeing people in the very early stages of their postpartum experience, is that if they're not feeling well, like if they had a difficult birth or their health has, been impacted in some way through their pregnancy or their birth process, that they may not feel like they're really up to the work of caring for their baby as easily. The frequency of it, the sort of, again, relentlessness of it can feel really, really challenging. So in situations like that, I feel like my approach is always to be like, what can we take, kind of the elements of this that are flexible, what can we change to make this more supportive to your well-being and your healing, so that we can take a step back, your baby can get fed, we can make sure it all works, and to support them in their goals to get back to that. That's something that I feel like I deal with quite a bit in those first couple of weeks. Some parents, I feel in our culture, again, another thing that there's a lot of messaging around, I use this, I'm putting quotes on it, but breast is best. And there's all these kind of messages around breastfeeding that parents don't even maybe realize they're being inundated with as they're expecting their baby. And sometimes I feel when you get to the point a few days into their postpartum experience, if things are not going very well, they feel like very kind of undermined by the messaging of that they start to recognize, like, I thought I really wanted to, I felt very committed to this, or I know it's best for the baby or whatever, but this is really hard for me. And they don't even sometimes want to admit to themselves that they may not want to continue with it. And I think that's one of the things that I work through a lot with people too, is like, working on those feelings about that, but then also specifically like, okay, so what are your options? What choices do you have in feeding your baby? And you know, along those same lines, like, is it failing if you decide not to breastfeed? Can you have sort of the best of both worlds if you feel like you want to instead pump and give milk in a bottle, or breastfeed some of the time and give a bottle the other part of the, you know, for the other feedings? It's kind of a wide range. There's a lot available, but I think it's helpful for families to explore that if it's not going the way that they thought it would, or if they start to realize like there's something about this that doesn't work for me and isn't feeling as good for me. So those are some of the common things that I run into. I'm sure there's others that I just maybe didn't remember, but
Yeah, Kate, when you're talking about how this can be an overwhelming kind of, period, I think we should also note that if you are a mom who is neurodivergent, that it can be especially intense because after all, one of the kind of features of kind of, autism or being neurodivergent is, sensory sensitivities and the need for kind of recovery time. And of course, having an infant is an intense sensory experience. And for some for moms, some aspects of it may be really challenging.
yeah, I agree. Yeah, and I think that's part of the very individualized care that people need during this time, is that it's never cut and dry, you know, babies should be fed on this number of hours for this many minutes. I think it's very specific to each person's comfort with it, desire to do it, you know, what's actually practical for each family. Yeah.
So, great. So there's a lot going on. There are a lot of moving parts, so to speak, during this time period. So things can go amiss. And um, um, Johanna Neumann can help us out with this topics, but we've also been joined by Lauren Harris, who is the director of the Center for Perinatal Wellness in Northampton, and there's a large group, focusing on these issues. So, so I wonder, just starting with you, Joanna, what are some of the kind of issues that you run into with moms during this time period, and what are some kind of misconceptions that moms, can be struggling with during this time period?
Yeah, absolutely. A lot is going on during this time period. It's a very challenging time. There's like it has been mentioned, there's hormone fluctuations, but there's also so much more that can play into it, regarding like our history, maybe even a family history of mental health issues, your own history, a lack of support, past trauma, past abuse. There's so many kind of things at play. And I think there are a lot of misconceptions when it comes to this period in someone's life. In terms of mood disorders, perinatal mood and anxiety disorders that people experience, I think one of the misconceptions that people have is that if this is happening to you, then there's something wrong with you. And sometimes it's even hard to talk about it, even with your partner, with friends, with your providers, because there's some kind of guilt and shame that go along with it and a lot of different feelings. And I think it's important to note that there's nothing wrong with you. These feelings are completely normal, and that the statistic is that around 1 in 5 women will experience perinatal mood and anxiety disorders. And this is likely underrepresented. And in addition, with partners or with men as well, around 1 in 10 men also experience disorders during this time. And again, it's likely more. And I think another common misconception is that this can only occur shortly after giving birth. And I know that Mariana spoke a little bit to fluctuations in hormones. And during this time, there are a lot of hormones, a lot of fluctuations. Especially, in the first couple weeks after giving birth, you might hear that you have baby blues. People might just kind of attribute mood symptoms like sadness, crying, anxiety, all different sorts of things to maybe the baby blues. But if it continues past that, it could still be a perinatal mood and anxiety disorder. It's typically said, if you're experiencing any of these mood symptoms up to a year, but some people argue it's up to like the first 3 years after giving birth. So these are definitely experiences that people are having later on, even 3, 4, 5 months after giving birth. Some of these things might come up for you. And another thing that I work a lot with in my practice is birth trauma. Which I think a lot of people don't often think about. And basically what that is it's a traumatic experience during childbirth that leads to like an increase in distress. And I think kind of one of the misconceptions about birth trauma is that it only occurs if there's physical harm to mom or to birthing parent or to baby. And this is not the case at all. Birth trauma can exist and be caused by so many different situations. Maybe during the birthing process, you don't feel supported by your providers. Maybe you don't feel listened to. Maybe you didn't feel in control of the situation, of the event. Or maybe it just wasn't the experience that you had hoped for. Maybe you went into it with a birth plan. You went into it all prepared. I'm going to do X, Y, and Z. And, oftentimes that doesn't happen. So you can definitely experience symptoms of trauma after giving birth. And by symptoms of trauma, I mean, it differs per person, but, that you might be having flashbacks, you might be really easily triggered and having nightmares, you might be increasingly sad, you might be increasingly angry, and you might even struggle to kind of connect with your baby for a number of reasons. So that can kind of come up as well. And another thing which has kind of been touched on a little bit already is a common thing that I see is that people who don't initially feel connected to their baby feel like there's something wrong with them or like they're a bad parent. And I think one of the things that we're led to kind of believe is that when we give birth, they put the baby in your arms and it's love at first sight. And, you just automatically feel connected to this person. And that is often not the case. It's completely normal to not feel that initial connection for so many different reasons. And you might really struggle to kind of make that connection with the child, and that's okay. And that doesn't mean you're never going to get there. But some things that I've seen in terms of people not connecting is kind of maybe blaming the baby if there was a traumatic birth, maybe feeling guilt that, something happened to the baby in terms of birth trauma, feeling like it was your fault. So there's so many different emotions and feelings that can go along with that. But the point I just basically want to get across is that is a normal experience.
Joanna, from my, kind of perspective as someone who, sees, kind of, children and parents, my impression is that women really do not have permission in a way to, let me put this very poorly, have a birth trauma. That there's really not kind of permission to have that story, or it's and to really kind of just allow it. Am I off base here, or what are your thoughts? And
No, I don't. Yeah.
yeah, and I'd be interested, Lauren, in your thoughts about this as well.
Yeah. Yeah, I don't think you're off base at all. I think a lot of times we don't give ourselves permission, is one thing that I'm kind of seeing. You have this experience. Your birth did not go the way that you wanted it to for, X, Y, and Z reasons. A lot of times you're physically, I mean, you gave birth, you're physically recovering regardless of what type of birth you had. And you're immediately kind of thrown into this role where like you need to breastfeed. They're telling you need to breastfeed every 3 hours. You don't have time to sleep, you don't have time to recover. Any other hospital stay or procedure, anything like that, you get recovery time. And in this moment you don't. You're kind of just thrown right into being a parent. And a lot of times there's not a lot of support around that or any time to kind of process what happened to you. And that can kind of just fester and grow. And it can be a really, really hard thing to even get to the point where you're able to even relive that experience, able to recognize that experience, and kind of be present with it. So it's an exhausting time, and it's hard to kind of focus on that.
Lauren, do you have some additional thoughts, or?
I do. Thank you. I agree. I think a lot of times new parents are not allowed to have, they're not allowed to process their negative events or their negative feelings or their uncomfortable feelings about what just happened, especially if the birth results in a live birth, where everybody sort of made it out okay. Oftentimes I hear from my clients that, well, yeah, that was hard, but when they do share a hardship that happened during labor and delivery, well, I mean, everybody's okay. It's okay. It all ended up fine. And so when they do try and reach that vulnerable space and share their experience with family or friends, they kind of get poo-pooed away, like, well, everything's fine now. And so what my clients and the other clinicians who work for me hear often from me is there's room to hold both. We can hold gratitude that, yes, everyone made it through this process alive. But that doesn't mean that there weren't periods of that time that were scary or perhaps life-threatening or. There's a whole lot of things that can happen. And so I really lay that on thick with the people I work with, is that there's room to hold both. Because also I want to convey to my clients that just because they're struggling or having nightmares or flashbacks or some hypervigilance about something terrible happening to the baby in the bassinet next to them, that doesn't mean that they are willing some tragedy into existence. They're not manifesting a tragedy to happen. This is their nervous system trying to protect them in a way in the present that it didn't feel protected during the event. Yeah, PTSD is something we deal with really often in the practice. And I think it's not something, it's one of the fewer or the lesser talked about, lesser discussed PMADs. The other thing I see a lot, and I know we weren't really talking about this, is postpartum OCD. It's so common. I think it's really underdiagnosed.
So, you know, it's a topic with interest in kind of OCD. Quite interested. And it's a source of, at times, kind of tragic misunderstanding. So tell us about, you know, OCD postpartum and the kind of the intrusive thoughts that can be so challenging for, you know, a parent. What's the matter with me? And stuff like that.
Yeah. Because OCD itself is not well understood, even by clinicians, postpartum OCD is even less understood. And oftentimes when new mothers divulge that they're having these really intense and intrusive thoughts, when they disclose that on the Edinburgh to say their general practitioner, their PCP, I've had clients of mine who disclose this to a provider, and they called the police, they called DCF, they filed a 51A because they didn't understand, because the provider just truly didn't understand the difference between an egosyntonic and an ego-dystonic thinking pattern. And so they really, the provider was very alarmed that harm might come to the baby, which of course with postpartum OCD is almost never the case, because the thoughts are so distressing that harm will come to the baby. The mother is doing, primarily the mother is doing everything in her power to prevent harm. Some common intrusive thoughts that happen. Mom won't typically talk about it. And so this is where education for family members and partners is so important, especially if there is a pre-existing history of anxiety or OCD. Mom won't generally talk about it, but you can see that it's happening in behaviors. A common one is she won't give the baby a bath, not alone. She'll need another adult there. She won't walk down the stairs with the baby, because these visualizations, and they really are visualizations, different than a hallucination, clearly not a hallucination. She doesn't actually believe it's happening. What she's seeing in front of her, it almost feels like if you take that first step down those stairs, this is what's going to happen. And it feels so real in every fiber of her being that she'll hand the baby off and walk, to a partner or someone who's with her, or she'll yell like, "Oh, can you come get the baby? I have my hands full," right? There's going to be an excuse why she can't walk down the stairs with the baby. She's going to be waking up a lot in the middle of the night, even when the baby is sleeping, because she's going to check on the breathing, right? These are our moms that are going to buy every single little gadget right? That owlet sock to keep track of the heartbeat and the breathing, right? These are the things that we look for. This is how it kind of manifests.
So, Joanna and Lauren, how do you help parents, caught in the throes of these intrusive thoughts? What do you do? What's how can they be helped?
Do you want to go
There-
first, Joanna?
I can start.
Okay, go ahead.
So if someone is experiencing these thoughts, you recognize them as being you recognize these thoughts as being these obsessive, intrusive thoughts. You recognize it as not being psychosis, which is something that can also happen, but that's often when someone doesn't recognize that these thoughts are illogical, that they don't see the thoughts as being illogical. There are a number of different techniques that you can use in order to kind of work with mom. And some of these techniques, like one of them involves cognitive behavioral therapy. So that can be kind of acknowledging or recognizing the initial behavior, and recognizing the initial thought. So for example, the thought of, it's just to be clear, I'm thinking I'm gonna drown my baby. I can't put my baby in the bathtub because this is the thought that's going through my head. You recognize those thoughts, then you're able to kind of recognize what your behavior is in terms of those thoughts, what your feelings are. And then once you're able to recognize it, then you can kind of move towards, figuring out other kind of healthier ways to kind of cope with it. So you're recognizing these beliefs and then figuring out, how to work through that. I think there's also a number of other techniques that can be used. There's relaxation techniques, there's mindfulness. Again, kind of just figuring out when these thoughts are happening and, getting yourself to consciously be able to stop them. Sometimes there's visualizations that you can try to kind of deal with that. Sometimes it can be something like just even, I have those thoughts, visualizing a stop sign in my head, visualizing something and trying to recognize that and get yourself to stop and then kind of redirect yourself. There's techniques, involving kind of questioning it, you're having these thoughts, what would you say to your friend if they were having these thoughts? How would you respond to that? What would you say to a stranger who is having these thoughts? And kind of just get people to think about it a little bit differently. And just kind of see what works, work with them and kind of see how you can kind of get through those feelings and those beliefs. And I'm sure you have more to say maybe about ERP or something.
Well, one question I'm a little curious about is, by virtue that you have this nonstop needy little pumpkin who needs your attention all the time, it is, the baby in a way provides kind of an exposure to your worst fears, all the time. There's a certain amount of avoidance that you just can't do when you have to take care of a baby. You can't, is there any indication that the course of postpartum OCD might be a little different? It might have some limitations on it, given that having a baby is basically, as they would say in OCD language, kind of a whole exposure by itself. And any thoughts about that? Or any sense of whether there's any evidence that there can be some constraints just by virtue of that babies are just one big exposure opportunity after another?
Yeah, I'd love to answer that if that's okay. So what I've found with my mamas who are experiencing postpartum OCD is that as their baby grows and develops, anxiety and intrusive thoughts like to jump around to the next idea that you can't prove.
Mm-hmm.
Right? So for example, if the intrusive thought is my baby's going to slide under the water and perish. Well, of course that's not going to happen because you're right there, you're watching. Or you have another adult with you. And I do want to add also that the two examples I gave previously about not walking down the stairs as being of one of the intrusive thoughts, and also the drowning as the other intrusive thought, I don't fight my clients on the way that they are coping with those intrusive thoughts. I really don't see anything wrong with having another adult with you while you bathe your baby if it is too distressing for you to do it alone. And I don't fight them on passing the baby off to their partner or another adult to walk down the stairs with the baby, because that's what they need in order to soothe themselves. It's how they feel they're keeping themselves and their baby safe in those moments. So yes, to your point, having an infant is constant exposure therapy. However, that there are other thoughts that pop up as the baby hits milestones, like sitting up, like crawling, like climbing, or cruising rather. There are other things that happen. However, what I use as the baby, let's say, is 6, 7, 8 months old, I can use all of those previous months to go, and look what never happened.
Mm-hmm.
But the very first thing I do, first thing out of my mouth after a client discloses these very distressing thoughts to me, is I sit with them and I say to them, I know you would never harm your baby. You don't have to convince me of that. I already know. And then I talk to them about the differences between postpartum OCD and postpartum psychosis. And almost always, the person I'm sitting with tells me that they feel a great deal of relief just hearing from a provider that that provider trusts them, that they will never hurt their baby. And here's why. Because here's what I'm saying. This is an ego dystonic. You are so distressed by these thoughts. You do not feel validated, or these thoughts don't make sense to you either. And so even just hearing that brings them a lot of comfort and helps move the process along. So we do some rapport building, obviously. And then we do some psychoeducation and we name it. And we go, oh, that's catastrophic thinking. Or, oh, you're having intrusive thoughts. And you put names to it so that when they're experiencing it, they can go, oh, this is that thing that baby crazy lady who owns that weird place said. Right.
Just kind of curious, Kate, do you see this kind of phenomena at the kind of early age in which you're dealing with, moms and infants?
I think in my setting, they may not admit at the same level what they're thinking about, these examples, but I definitely see the beginnings of that with every noise wakes me up. I haven't slept in days. Yes, we bought the owlet sock, those kind of things. Yes, I see that. Something that's been occurring to me though, hearing more about this from Johanna and Lauren's perspective is, Mariana, is there a correlation between, like, if somebody's experiencing this and it's progressing, what the the perinatal anxiety, OCD, any of those, does it inhibit their progression as far as like their learning capabilities of their baby? Is it a direct correlation, or is that very individual too?
Sorry. Yeah, no, I think it's very individual, and because I really appreciated that question, because in a sense you want parents to be fully aware of what their babies need, and I think having intrusive thoughts is a way to be prepared for things, right? And so I think, like, to some extent there is this kind of hyper awareness of not only your baby but the surroundings and what can potentially harm your baby, right? And but then, there's I think the issue is when because I think there's also like the difference between struggle and suffering, right? And I think parenting is a struggle, right? It's not supposed to be easy, right? You're like in charge of helping a very immature individual to not only to survive but to thrive, right? And it takes a lot of resources, right? But I think when that exceeds the struggle and becomes suffering, right, and becomes kind of like impacting your way of interacting, right, or thinking that you might cause harm to your baby and stuff like that, then that is where I think it becomes I don't know, the feedback, that negative feedback becomes quite problematic for your well-being and how now you're experiencing that interaction, right? And so I do think, I mean, I'm not sure there's, or I guess I'm not an expert on how experiencing postpartum OCD impacts ongoing developmental changes in that relationship. But I can imagine that if that experience becomes less positive, let's say, that can limit your interactions with your baby, right? And if we're thinking that parenting requires time and attention, right? And if that is compromised by the way you're interacting, then I can see how it can impact somehow that developmental process. Yeah.
May I add to that? Thank you, Mariana.
Yeah,
Is that
please.
So I used to work in early intervention before, I mean, very briefly. I just ran like a mom's support group, but I was already specializing in this area when I did that, and had a lot of really great discussions with the director of that center. And what I've seen both in my clinical work and I feel was validated by the developmental specialists that I worked with there is moms who have an anxiety disorder, but even more so with OCD, their children sometimes aren't meeting gross motor or physical developmental milestones because these moms are going to be the helicopter moms. They're going to be very scared of baby pulling up on things because what if they fall? They're going to be very scared of baby cruising because what if they fall and hit their head? So same thing with walking and running and climbing and, on the climbers. And they're going to be the moms who are on the climbing apparatuses at the park. And they're a little more hesitant. These moms are a little more hesitant to allow their young children to move their bodies and use their bodies in ways that they might get a little bump or a bruise because of the catastrophic thinking that goes along with it, right? A bump or a bruise or a bump on the head equals, oh my gosh, a brain bleed or a traumatic brain injury. So that's what we see sometimes.
Yeah, and I certainly see that later on, in all of the anxious children that kind of come to see me, that as Lynn Lyons put it, anxious children, it's either by nature or by nurture. And the helicopter parenting more broadly in our society has been suggested plays a role in why this is more of an anxious generation among the host of other factors that may be playing a role. And interestingly, there's more interest now in kind of how we can foster independence in children, which has been, somewhat kind of neglected in more recent parenting. So we should just kind of just pause for a second just to see if the audience has any kind of questions that they would like to, venture, and maybe.
Hi, I actually had a couple of questions,
Yes.
unless somebody else did. So we were talking about changes in the brain, and I'm curious for subsequent babies, how does that look for the mothers, for their second baby or third baby in what is also possibly considered advanced maternal age? Is there any research studies on brains and their changes?
Yeah, so there's a lot of work showing that second time or or more, there's this kind of maternal memory, if you want. And so when we were talking initially how once a parent, always a parent, right? And how there are some changes that are permanent. And so on a second experience and forward, that circuitry that has already been primed once and been kind of practiced, right? Kind of reinforced on, it becomes, it's a more robust, if you want, circuitry now, and less dependent on individual, if you want, components. And so second time or third time parent often benefit from that prior experience and kind of and has a little bit of what we were talking about, the wisdom that maybe things take some time, right? Or maybe you have to kind of that babies are different, right? Like the idea that you as a parent don't parent all your children the same way, and that's because you see them different, right? They have different needs, and that and that takes practice, right? And trying, right? And so there are if you want, now you have more robust, if you want, circuitry supporting that behavior. And I think what I'm very fascinated about the maternal brain, and it's something that becomes more obvious on a second time or on a third time, is that the behavior has to be so plastic and so dynamic that you almost have to prevent habitual responding, right? That's like when you become like non-sensitive to your child's need, and when behavior becomes just instrumental, that's quite problematic, right? Because it's that contingency between what your baby needs and how the parents resolve those needs that allows for healthy development and allows for future social interactions of your children, and all that kind of thing. And so in a more robust circuit, you can see more clearly that not only you have structures in the brain that are important for this, parenting, but there are structures in the brain that are also inhibiting other structures from becoming very habitual in their responding, right? And so you always want to be flexible and attuned to what your baby needs. so the maternal brain has that advantage that with experience, it becomes a lot more proficient and more robust in their thinking. And I was kind of thinking that day we were in a volleyball tournament for my daughter, and we were there for hours. And there was this woman with like 4 kids, and the smaller one was maybe like a toddler, like 2 years old, and she was all the time on the floor, kind of like rolling around, and it's like you could totally see that was the 4th child. There's no way that the 1st child will be so much in contact in the floor of a gym, right, with all the sweat and dirt, and like, you know, it was like, and so you can, you know, that experience kind of allow us to kind of like regulate so much more your fears and your and your ability to solve problems, right? You know that you will figure it out, right? Because because you care about your child, and you just kind of need to kind of try different things until you kind of solve that, right? And so that's kind of reflected from a more like neurobiological perspective in more robust connections between brain structures.
Thanks. And if I could take it like just to a different perspective of that, I am thinking about my older child and their experience with this and how they are in this preteen adolescent phase of all their brain changes. Do you know if there's been any studies or thoughts about how it could affect that child, the experience of their parents going through this and them right there when they're 12?
Yeah, I think it's very beneficial for siblings to experience siblings, and also to experience their parents parent their siblings different. And I think it's particularly helpful if you talk about it, right? The idea, like as opposed, like the idea that it's not that the best parenting is the one that adapts to what the needs are, right? And so the idea that you parent perhaps your adolescent kid very different than you will parent your toddler, right? And that's because you see them for who they are, right? They have different needs. They need to reach different milestones, and I think I think that experience will definitely impact her social interactions with her peers and futures. You know, there's all this idea that interacting with younger individuals and if you know if you know if they have a baby sibling, then that's a little bit of practice too, right? It can, when we're thinking about how the experience of interaction kind of like changes your brain, that particularly in these kind of social cognition areas, then she might become a much more empathetic, insightful, being by having that experience of interacting with individuals that maybe are not as I mean, babies are very good at indicating needs, right? But it's really kind of falls in the other partner of that relationship to kind of figure out what those needs are, right? And I think that experience is beneficial, I think, for yeah.
So Mariana, in other words, being a parent puts you into theory of mind super Olympic training camp. You get really good because at day one, you're trying to figure out what this baby is thinking. So you're getting the theory of mind part of kind of trying to do that is getting a workout from day one. And that, and as parents, we could say that that's one of the benefits of being a parent is that we really, the theory of mind part of our brain really gets a lot of exercise.
Yeah, absolutely. And I think if you have had the opportunity to practice that ahead of time, you are less surprised by that change. You know, you're more already attuned to others, right? And so it's not as it's not a surprise, or it's not such a dramatic change as for others. I think it's quite the shock how much their perspective has now changed, and it takes, you know, a bit of adjustment, I think.
Other questions, Kate, or?
I do. It'd be switching gears to thinking about breastfeeding a little, Kate. Hi, Kate. Haven't seen you in a while. I think you're the one who mentioned it too. I think it might have been you, somebody else, about how many products now are like shoved in our face. And it's really clear to me, having a almost 12-year-old and an almost 8-year-old and doing it all over again. Whoa, like it has exploded, and social media has made it even crazier. And saw on like baby apps and like on social media, all this idea about collecting your colostrum early and like how that can benefit not only your baby, but your body. And I just couldn't find anywhere to like any actual facts or truth on that. And if you had any thoughts on it, because that was not something I was told about other times.
Yeah. Well, first of all, congratulations. That's exciting. This idea is a little bit newer in mainstream. It primarily was recommended if there was like a known factor that would cause the baby to need supplementation right away. So most of the time, like one example would be if a mom had gestational diabetes, and it was likely that they were going to be testing sugars and be a little bit more worried about that kiddo maintaining a certain blood sugar level, they would recommend that the baby be supplemented. And most of the time, previously, it was done with formula, or if the mom could pump in the hospital. What came of that a little more recently is collecting the colostrum ahead of time. As far as the benefit to your body, there is a lot of evidence that hand expression just prior can be helpful for sort of setting the hormonal tone for your body for solid, strong milk production, but even more so, I think, in that very, very early postpartum period. So I think sometimes it's been extrapolated to like you could do it a little bit before and get away with it. Some people, depending on what's happening in your pregnancy, though, it's very contraindicated. So I would say general rule is not to start before 37 weeks postpartum. But as you mentioned, there is, of course, that very strong influence of social media and all the products that are available now. And of course, they sell the cute little like millimeter or milliliter collection tubes for it. So you see it more often now. I think if I remember correctly, and I can send it to you when I'm back in the office, but I think the Academy of Breastfeeding Medicine actually has a protocol on it, so I can look it up for you.
Thank you.
Yeah.
So we're sort of moving towards the kind of end, I guess, unless there are some other questions from the audience. I have Kate was just kind of referring to this, parents are inundated with all sorts of advice and things that they should be doing and stuff like that. And I would be wondering kind of just the comments you guys would have, and how does how can we support, how does a mom develop the kind of intuitions of kind of getting to know her baby in the face of all of this? How do you do it? And I think there's a lot of stuff to sort through. I think even the statement by famous Dr. Spock, who said to moms, "You trust yourself, you know more than you think." was definitely an improvement over what came before. But if we kind of think about that, it's also a problematic statement. So I'd be just interested in if you have any kind of thoughts about how do we support during this vulnerable time period, developing your sense of, how to parent. So maybe it's not an answerable question, but just kind of saying it. But all right, Johanna, I want your thoughts. I'm going to put you on the spot.
Okay. Yeah, there's a lot of information out there which can cause a lot of uncertainty for people, can cause a lot of judgment of ourselves, of not being good enough, and can kind of make it difficult to develop that sense of how to parent. There can be a lot of other factors that go into it, as to kind of how we had talked about before, trauma, maybe experiencing loss in the past, different things like that. I think reassurance can be helpful with people who are trying to kind of develop that sense of parent, and kind of just questioning and talking to parents, and just asking questions, how, or even from a significant other or somebody, I I noticed, that you did a really good job, doing this with the baby, how did you do that? Or, just being curious with the other person, and also just trying to, I guess, connect with them, and trying to get them to recognize that they're already doing the things. Your chances are you're already, even if you're judging yourself, you're already being a good parent. You're noticing your child, and you're noticing kind of what their needs are. And you might not see that, but it's likely going on. And like with talking with the brain development, these are things that are constantly going on with a person. So I think just kind of bringing that up with people and letting them know that they are doing a good job, giving them validation, and kind of helping people to grow in that parenting role, if that makes sense. So I think that that intuition is there. That intuition is there, and just kind of recognizing that it is there. And even with being bombarded with all of this information all of the time in the media and social media, wanting to be the perfect parent, you're doing the things, you're doing the right things. And we all are different, we all do things differently. But just because so and so on Instagram is doing one thing doesn't mean that you're not a good parent and you're not meeting your child's needs.
Okay. Any additional thoughts, Lauren? Or you don't have to, but just.
Yeah, I think I want to echo what Johanna said, nail on the head. Yeah, you're doing a great job. That validation, especially for new parents and first-time parents, is so, so important. Another thing that I'll do oftentimes with parents who just feel like, oh my gosh, I totally have no idea what I'm doing, and they present with this very real overwhelm, I'll try and get them to identify a couple of values. What's important for you, right? The goal of parenting is to raise a happy and healthy, productive member of society, right? And so what is your sort of general plan to get them to that point, right? Do we, what are the values that you want to instill? Are you going to be a mama that cusses, or are you not? Are you going to have alcohol in the house, or are you not? Are you a parent that believes a tap on the bum is the right way to discipline, or are we going to get down on the child's level and say that hurts mommy's feelings? We don't do things like that, right? There's no real guidebook, but when someone hones in on their values, that kind of gives them a pathway. And of course, if someone says something that research shows is not productive or even detrimental, I can point them in that direction as well and help educate. Psychoeducation.
Right.
Mm-hmm.
Great. Well, we're about out of time. And so thank you, everybody, for carving out part of your Sunday afternoon to kind of have a conversation about this important and delightful topic. So thank you very much.
Thank you. That was wonderful. Thanks, everyone.